I'm Dr. Allan Perel, and this is Conversations in Medicine. I'm Dr. Allan Perel, and this is Conversations in Medicine, a program devoted to bringing cutting-edge medical topics to the Staten Island and New York City and entire tri-state community. We have a very special show, something a little different. We're going to be talking about pet bereavement tonight. As a physician, I see so many people who are affected by their pets, of course, for the positive, and then when a pet passes on, certain issues occur with regard to being depressed, sadness, how they cope with it, and sometimes it brings out other medical conditions. I have two very, very special guests tonight. To my left is my wife, Susan Perel. She's an LCSW, a social worker, wonderful person, wonderful wife, and runs a support group for pet bereavement, and just so proud of everything that she's doing with it. And to my right is Dr. Lisa Esposito, a veterinarian. She's the medical director of the Richmond Valley Veterinary Practice on Staten Island. And a true pleasure to have both of you here.
Thank you.
And I want to thank you both for being here. So we're going to talk about pet bereavement, and maybe you can give me some definitions. Why don't we start with some definitions? What is pet bereavement?
So when we talk about pet bereavement, it's very similar to a bereavement of a loss of a friend or a relative. Bereavement basically means to be bereft or to have a loss, to go through grieving and to be missing a person, a friend, or whoever. And it's the very same thing with a pet bereavement. It's, our pets become a part of our family. We get very involved, very close with them. Part of our daily routine is to have them in our lives. And when, for whatever reason, they pass, when we lose them, it's a terrible feeling of loss, and the grieving very similar, the same as when we lose a loved one or friend.
So Dr. Esposito, Lisa, for a good friend of mine, let's talk about what you've done. Right now, I know on Staten Island there's a group,
Yes.
and you're looking to do this possibly citywide.
Right.
Tell us about what your vision is for this process.
Well, the vision is to help people who are grieving to discuss their pain, and because it's a very private grief. There's no real societal norms. For example, the Catholics, you have a wake and a mass, and there's no societal mechanism to accept the pain, the real pain that we go through when we lose our pets. So I had called Susan after I lost my dog Jaja in September. But what happened was some of my friends that were in my support group, they lost their pets too, and two of them were quite unexpected. One had pancreatic cancer, she was young. One of them had a tumor in her heart and her spleen, and very acute and sudden, and we were all really grieving. And one of my friends said, why don't you start a bereavement group, which I had already thought about it. So currently, through our Richmond Valley Veterinary Practice, we're doing it at the Regina McGinn Conference Center, but I'm also on the executive board of the New York City Veterinary Medical Association, and I requested that we try to set this up through the VMA of NYC in a citywide. So we're going to be hopefully launching that in September and October. So I called Susan because first of all, I know how kind she is, but her educational background, I asked if she would head the bereavement group, and she's done a great job.
Oh, thank you.
So tell me about what qualifications does it take to really run a group? I know you're a social worker. You've had a lot of experience with patients over the years. Tell me a little bit about what it takes to actually, what skills does it take to run this group, and tell me about the group, a little bit about the group itself.
Sure. So, just like at the beginning, there are many different types of support groups. Not every support group is run by a clinician. Many support groups will just have a leader, someone who has a common experience as the rest of the group, and they run it themselves, or maybe someone who's one of a take charge person in the group. So our group is run by me. I'm a clinical social worker, and my training teaches me about stages of grieving and about learning about coping mechanisms, and how instrumental all of this training is into leading the group, getting people to talk in a helpful way, support each other. The goal is really for people to support each other, and for my role is to try to step back and just sort of orchestrate kind of quietly from the sidelines as the group takes off. There's different types of support groups. Some support groups are closed when it's the same people week after week or month after month, and other support groups are open where different people come at any time and all are welcome, and it has a different dynamic than a closed support group. And this support group is an open support group. So people learn about it, they feel like they would like to see what it's about. There's no rules really, they could speak if they want, they don't have to, they could be more passive and just sort of take everything in. Some people are more comfortable explaining about their experiences, and others are more reticent. And it's in a therapeutic type of environment. Really just very like a lot of support to each other, getting people to be able to talk about their experience. And as a clinician, one of the things that I'm looking for is to screen out any participants that might be in trouble, and they might be stuck in their grief, or they might be overwhelmed by their grief, and they might need more support. And these are the people that I'm on the lookout for all the time, to try to maybe speak with them after, or they'll approach me and maybe make a referral for a physician or for individual therapy or something of that nature. But that's basically the picture of the support group. This particular support group is an open support group, and I'm leading it. A clinician is leading it. And we're very lucky to have Dr. Esposito with us in the group. Many of the patients know her. She's able to answer medical questions. It's quite a gift that she's there. It's very unusual, actually.
I'd like to ask you both a question. Some people, many of us who've had pets, some of us have very short grieving periods, some of us have much longer grieving periods. Is there something that you could tell when you see someone come in with their pet to your practice, and Susan, to your group, that gives you a clue that there might be a problem in the future? What telltale signs do you see?
Well, sometimes they'll refer to the pet as the most significant person in their life, their child. They'll actually verbalize that they'll kill themselves, and I've had 2 clients that did kill themselves, not right away, but probably related to it. And you can tell by the degree of emotional, and I suspect if I was a client that I would have that degree of emotional distress, because when I lose my pet, I called Susan up and I couldn't even talk during part of the conversation. I was crying, then I had gotten sick to my stomach, and I went through a lot of symptoms. I know how to reconcile it, but yeah, so there are certain people that you do worry about, but then you never know how to approach them and encroach on their lives, so I think it's good we have this as an outlet.
And the truth is, you could never predict how someone's going to react when they have a loss. Sometimes we think a person is going to have a very difficult time, and they do better than we expect, and other people that we can't predict seem to really be struggling. So I'm not sure it's so easy to predict. Yeah.
So tell me what you guys do in your group. In a sense, if someone comes in, and as Lisa was mentioning, people who are very depressed, very upset, crying over the situation, how do they leave your group and how many, and it's, I know it's not sessions because it's an open group.
Right.
How long would it take them to feel better or try to cope with the process?
Do you want me?
I think it's subjective. I'm not sure if there's any statistics on, but I know, I mean, grieving in general with reference to pets, you know, the first 2 months are more acute and painful, and then on the average a year, but people can grieve for years. But as far as our group, I'm not sure if you want to comment on that.
So one of the beautiful things about our group is that there are people at different stages of grieving at the group. And this is one of the goals when you run a support group, is it's a wonderful thing if you could have that. So in other words, people that just lost a pet versus people that lost a pet 3 months ago, 6 months ago, and they kind of could work each other through. If you have a whole group of people that just lost their pet the day before, that's kind of a highly charged emotional situation. And the goal is to have them support each other and help each other through the process. Even though they're still grieving, it's a little bit different at 3 and 6 months than at the day after, you know, you lose your pet. Is that?
Yeah, that does. And Ben, how often do your group meet?
We meet once a month.
Do you think that's adequate?
I think in the initial stages, you maybe don't talk about it enough. I know I basically shared it with a lot of my clients because I want them to understand that I know how it feels to lose a pet, and I always want them to feel like they could talk to me. So clinically, I'm not sure. Emotionally, I talk a lot. That's my catharsis when I'm very upset. I don't internalize it, which probably helps me. From a clinical standpoint, do you think once a month is enough?
I do. I think once a month is fine. I think that it's fine. It's because too often I think we get maybe too personal, and we don't really. That's not. I wouldn't really want our group to get too personal, because it's not. It's more for the. There's a group process that occurs, and if people start talking about themselves and the specifics about their lives, and it changes the context of the group. And I also just want to say, as social workers, there's a general understanding about coping. And one of the, there's like 6 or 7 elements that we look forward to see if a person is coping and to help them cope. And one of the things that is like the number one in the list is for them to talk. And the beauty of our group is that you want to talk to people that have had similar experiences that you've had. For example, if you say, let's say, God forbid, you were in a car accident, and you want to talk about it, and you're talking to people that have never been in a car accident, they could be sympathetic to your experience, but they can't really be empathetic because they didn't have that experience. And when it comes to pet bereavement, it's somewhat difficult to find people that have similar experiences that you've had, unless they've had a pet and they've had a certain level of attachment and relationship with their pet. And the beauty of our group is that we're providing that peer group for them so that they can say things. They don't have to say, you think I'm crazy, but I'm more upset about this than losing my dog than I was about a relative or whatever. Whereas other pet owners who are grieving would understand that. So it's very important when you want to talk and you want to ventilate how you feel, to find people that have had similar experiences and they really could relate to what you're saying without you feeling judged or uncomfortable, or that people really don't understand what you're talking about. So that's a very big step in the coping process, is to be able to talk to people and let it out, and knowing that they understand, at least in some way, through shared experience.
So Lisa, tell us, as a veterinarian, the idea that it's unique. This is somewhat of a unique process. Usually most support groups, you don't have the physician, the doctor there. Usually you have social worker, psychologist, someone running the group, even as Susan mentioned, people who were just lay people who are running their own group, just to be able to say things. The uniqueness of your group, it appears, is that you're there on occasion. And the questions that come up about the animals and things of that nature. Tell me about what do you think about being in the group? itself. Not just you're running the group,
Right.
you're there, you're part of the group, you're seeing a lot of your clients, your patients, people who are there. How does that affect you in different ways?
Well, I'm there also because of the pain that I'm in, and also I want to be there to help the clients and the pet owners, because I feel that I would encourage people after they lose a pet that they should, if they have any questions that are denying them closure from a medical standpoint, I think it's very important that they engage in a amicable conversation with the doctor. And we don't get as much objective data that we would like to on our patients. Like, we can't do CAT scans on every patient. We can't, we can't do as many diagnostics as they do almost immediately on the human side. Some of the specialty centers, it does get done, but not every patient goes. And so I feel my role there is to also let them feel comfortable asking questions, and to know that, and I hope and I'm certain in some regards I represent a lot of veterinarians that really care. I mean, veterinarians have a very high suicide rate. It's the number one, it's actually a crisis right now. And that's only one of the factors, is the empathy we go through for our patients and the sympathy for the clients, and it's a lot. It's a lot to take in. The medical, you want to be successful in the medical part of it, and so I'm there in those roles.
So tell me about some things that are unique about this. You've had a lot of training, you deal with multiple sclerosis patients in our center.
Sure.
You take care of a lot of people for their own medical problems. How is this different for you than someone who's got their own medical problems? And again, I'm not sure it's so that different, but what do you see with your perspective on this? How is this group different than most of the groups that you deal with?
Well, I don't think it's that different. I'll be honest with you. It's very similar to other bereavement groups that I've run, or I've run groups for parents of disabled children, children with cancer, parents who have children with cancer, a whole litany of different 9/11 related issues. I've run support groups. I think it's actually more similar than dissimilar. Mm-hmm. This is, our loved one, our, pets become a very big part of our lives. I always said there's a special bond with a pet, I think more so because they're not verbal, they don't speak, so we often, on a psychological level, project our thoughts and feelings onto them. Mm-hmm. So it's almost like a spiritual bond, not just a loved one. It's like deeper than that. We project their thoughts and their emotions, and they're part of our everyday life, and when we lose them, it's like a big chunk of what we have in our lives every day is missing. If you have a cousin that you see 3 times a year, you might miss them and feel bad, but it's like a little different with the pet. They sleep in your bed with you, some of them. Mm-hmm. And it's not just dogs. We have to be clear that it's any pet. It could be any pet, all different types of pets.
Do you see this differently with people with different pets?
Yes.
So tell us a little bit about whether it's a dog, a cat,
we're a small animal exclusive, but cats
what does that
and
mean?
dogs. We do only cats and dogs at our practice, but people get very attached to their birds and their reptiles and horses, of course, because they have a long life and they're very interactive. And yeah, it just goes across. Dogs and small animals that are domesticated that live in our homes, I think it elevates the experience of the bond quite a bit, but sure. Yeah.
And the other issue that I think is very relevant is oftentimes, I don't know in other countries, but Americans in our culture, we think about getting a pet when we're going through something difficult in life, and the pet fills a void, or it gives you something else to think about, or whatever it is. It's very prevalent that people will get a pet to help coping with something else. And once we lose that pet, sometimes it's a cascade of what starts to come to the forefront of what starts. We might re-experience the loss that took us to have a pet. That might pop up. It could be more there's 2 types of grief: simple grief and complicated grief. And this would turn into a more complicated type of grief if it's compounded with other elements. Like we had a lady in one of our support group who said that she lost her husband and got a pet within a few months, and that really helped her cope with the loss of her husband, having the pet and having something else to think about and focus on. And when her pet died, she started to grieve her husband in some ways all over again. That's we call that complicated, complex
If someone
grieving.
can't get to your group for whatever logistical reasons, could you give them advice, you only say advice, of what to do after they lose a pet? And what thoughts they should do? Is there anything constructive they could do? Should they get another pet immediately?
Yeah, this is such a good question. I don't know if you want to have my thoughts. So there's no right answer. Everybody is different, and whatever works for you, for what your lifestyle and who you are and what you're going through, then that's the right answer. Some people get a pet right away, not to replace the pet, but more to because they're pet people and they want a pet in their life and they miss having that relationship. I know people that always have multiple pets because just of this concern, maybe an older pet, a middle-aged and a young pet, or just the two, because they never want to be without a pet, because that's their culture and their lifestyle, and that's how they feel. So there's no right or wrong answer. Whatever's right for the person is the right answer.
And maybe just talk about it, because if someone comes in with a animal that's terminally ill, and if the decision is made or the pet dies, what advice do you give them at that time in order to be able to cope better?
Well, I always try to speak from my personal experiences with the pain that you go through, and it's not to be minimized. For me personally, I tell them that when I lost Hunter, that everybody knew him, Hunter. Beautiful white bulldog, and I say that I waited almost a year, and I go, I don't know why, because all I did was cry and talk about Hunter. So then I adopted Jaja, and then, but now I have multiples, like Susan said, because after Hunter died, there was such a void in my house. And it wasn't my first dog that I lost, but it was my first dog living in my home without my family, that I grew up with. But after Hunter died, and I would drop my son off at school, and then I would go back to my house, and I would interact with him. And then when I would come home the first day, he wasn't there, and it was just so oppressive, and I couldn't take it, and I packed up and I moved to my mom's house for a few days just to get past that initial period.
The void. Right.
So, but it's a very personal choice. I had one client that got a pet in a matter of hours, and I was like, you're my idol.
Right.
But I do, on a personal note, I recommend having one, if not multiples, because it is very painful. But the other side of that is, the other pets will be connected, and when Jaja died, Terrence actually initially didn't react, and then it hit him that there was something very wrong in the dynamic of the pets in my home. And then it made me feel even sadder watching him show he was very anxious. Like when I would leave, he never would pay mind to it, but he would look at me like this, and he would run to the door with me like, where are you going? What's going on here? And I had to take care of him as well,
Like
which is fine. There was
anxiety.
protocol for that, just interact more with them. So it's a very personal experience.
There's no question that there's some grieving process that the pets go through, and they even can sense when their friend, another pet is ill, or there's some change in their health. Yeah.
So tell me, we're coming to the end, and I just want, do you see a lot of your patients needing medication? I mean, how far does this go? And I think maybe we're taking this as a very serious topic, and I think that's what's important.
Very serious.
Very
topic.
serious.
And sometimes people out there don't believe this. They say that there are other reasons to be upset, and this is not one of them. But clearly, I see this with patients in my practice as a neurologist all the time, coming in and I'm saying, what's the matter? And they'll tell me a pet passed away, and their lives have been changed. Does this all, when you see your clientele, your patients, your group, Do you see a lot of these people who need medication because of this? Do you think that that many of these people need more intensive psychotherapy than we're able to give?
So, in order to answer that, I want to review a little bit about the stages of grieving. I think that that helps shed light on how a social worker looks at this whole process. There's a woman, I have a few minutes, named Elizabeth Kubler-Ross. In 1969, she wrote a book who's basically a classic in the arena of death and dying. And she was a psychiatrist, a Swiss-American psychiatrist, and she had very interesting life experiences. She talks about, she had been in Poland and went to visit concentration camps and saw in etchings of butterflies, hundreds of butterflies in the concentration camps, and it stuck with her through her professional life, trying to make sense. And she felt that there was something more about grieving and about death and dying than people were understanding. So the stages, just to go through it, is denial, anger, bargaining, depression, and acceptance. And I always had an issue with the denial. I don't know if she meant it in a Freudian way. I think she meant it more like shock, like denial, meaning like even if you expect death, it's still shocking. And the mechanism is that people supposedly travel from one of these, from these elements, the denial, the anger, to the next. And you could go back and forth between them. And the whole process, they say, takes between 1 and 2 years to get to the acceptance. What we look for are for people that get stuck in maybe the anger or the bargaining or the depression, and they're not moving on. They could move back, maybe they could be in the depression and go back to anger or something like that, but they're stuck in one of these elements. And as a social worker, if we feel a person is it's affecting their level of functioning in their life, the grieving, then they do need to see a psychiatrist. They might need medication. There are other predetermining factors. Do they have a history of depression, a history of mental illness? Have they been on anti-depression or anti-anxiety medications in the past? This could trigger a difficult grieving reaction. And yes, it can be helpful to have psychotherapy or to see a doctor if we feel people are stuck or they're really struggling.
That was beautifully said. Really learned a lot from that. Thank you. I mean, the idea that this is similar to other grievings, losses, whether it's an animal, whether it's a relative, whether it's losing your job, a divorce, all those type of things.
Absolutely.
So we're coming up to the last few seconds. So Lisa, maybe could you just tell the Staten Island community about what you do, how often you meet, and how you can help someone. There's no charge for this.
No.
This is a free event. Tell us a little bit. We have a few seconds.
So our particular group is currently through the Richmond Valley Veterinary Practice. It's mostly for our clients. However, you can contact me if you wish to attend our group. We hope to go citywide, probably in autumn, through the Veterinary Medical Association of New York City. And I just want to say I'm very grateful for the opportunity to talk about this, because I think there should even be a national dialogue on the pain that people go through. I think people should be able to get days off from work if they need it because they're grieving, and it's very serious, very important.
We're actually coming to the very end. I want to thank everyone for watching, talking about a topic that we sometimes don't talk that much about that really affects many people's lives.
Thank you.
Thank you,
Susan.
Thank you.
Thank you both.